My name is Fortunate Kabura. This is my wife, Katutu Sandra. I'm the father to baby Haniel Sima. We are from Uganda. Baby Haniel was diagnosed with the biliary atresia, a case that we didn't know before. When baby was born, at around after 2 weeks, we realized that the baby had got yellowing eyes. He got gray stool. He got pale yellow urine. We thought it was a normal condition, and people were advising us to treat him locally. That is a disease that can be treated locally. But we tried to seek medical advice from the hospitals in Uganda. It's when they realized it is biliary atresia when he was 4 months. They tried to rectify the problem. They did a CAS-I procedure. We realized after 2 weeks after the CAS-I procedure, the same conditions came back: the yellow stool, the gray stool, the yellow eyes didn't change. Then it's when they were advised that we do a liver transplant. And we realized a liver transplant cannot be done in Uganda. It's when through a colleague who had done a similar case from Medanta by Dr. Sion, advised us to come to Medanta, and the baby got a successful liver transplant. And immediately, I think now you can see the eyes have changed. The stool is now okay, and the urine is okay, and he's now gaining very well. Yes, I just encourage people, when you see some changes like this, it is something that can be treated. Dr. Sion has supported us to have the baby have his eyes and urine again, and we hope, if worked on, our babies can get life again. Thank you.
Hello, my name is Katutu Sandra. I'm from Uganda. I donated my liver to my son of 8 months, like 2 weeks back. Now I'm perfectly fine. I have no problem, and my son is also fine. We are soon going back to Uganda.
Little 8-month-old Haniel came to us from Uganda in terminal liver failure. He had deep jaundice. He was in a very poor condition, basically would have died in a few months if he didn't have a transplant. Luckily, his mother matched him in terms of liver suitability, and she donated a small portion of her liver. Now, Haniel, being a very small child, needed only 1/8 of the full human liver for a successful transplant. Now, this is a very complex operation called a monosegment transplant, in which out of the 8 segments of the liver, we only remove 1 segment. In this particular case, segment 2 was taken from the mother and transplanted into Haniel. And as you can see today, he's a healthy, lively, playful 8-month-old whose parents are looking forward to a full life for him.
I'm sharing the story of Haniel, who came from Uganda with biliary cirrhosis. He was born with a disease called biliary atresia, where by birth his bile ducts were not formed. Bile ducts, they get the secretions of the liver in the form of bile into the intestine. When you do not have bile ducts, then you get jaundice, and gradually the liver worsens. Within a couple of weeks, the liver can get into cirrhosis. By the time the doctors in Uganda could diagnose Haniel with biliary atresia, he was already 80 days. He underwent a CAS-I potoenterostomy, a type of bypass surgery for biliary atresia, at 84 days of life. Sadly, like in most cases, these surgeries may not be functioning well. So, similarly, in case of Haniel, the bilirubin levels continued to stay high and he progressed to cirrhosis. What happens in cirrhosis is that the patient the spleen starts increasing, the liver gets stiff, and you develop fluid in the tummy, which we call ascites, or you may have vomiting of blood. Haniel was not growing well at all. He used to get recurrent infections and was doing bad in terms of growth too. That is when the doctors in Uganda suggested the only ray of hope for Haniel was to get a liver transplant to cure his illness and give him a new life. With that, the parents came to us at Medanta, the Medicity. After doing a preliminary workup on Haniel, we decided to proceed for liver transplantation. Liver transplantation are mostly in the eastern side are living related liver transplantation. In living related liver transplantation, the close parents, kith and kin donate a part of the liver to the child. In Haniel's case, mother came forward to donate a part of her liver, a small part of her liver to Haniel. And I'm very pleased to say that Haniel could be discharged from the hospital within 2 weeks of liver transplantation. This is not that the liver transplantation is easy in small babies like Haniel, who is 10 months and has a weight of 7 kgs. I would express my gratitude to the entire team because we do a lot of small children and have a lot of experience. We have a dedicated team where there is 1:1 nursing of the patient both in the ICU and the ward, and we have a team of dedicated pediatric liver specialists, 8 to 9 doctors in the department who work round the clock to give excellent results. And I'm so happy that Haniel could go back with smilingly. He and his parents were both happy with the work our team did.